Good afternoon. Welcome to the daily briefing in St. Clair County. Sam, the roller coaster. Do you feel like you're on a roller coaster?
I do. We would have a couple really good days, and then when we start to get a little comfortable and we keep our fingers crossed, and then, your stomach drops out again. So for when we report numbers today for our long-term care facilities, you guys will see that we did have some drastic jumps in some of our locations. But for tested that have happened for St. Clair County residents, we are at 10,509 with 1,546 positive test results, which is an increase of 41 from yesterday. And that does include both men and women from their 50s up to their 90s. We are at 8,902 negative test results with 61 results still pending. And unfortunately, we are announcing 3 additional deaths today, which does bring St. Clair County's totals to 117. The first was a male in his 70s, the second was a female in her 80s, and the third was a male in his 80s, all with underlying health conditions. And as always, our thoughts and prayers go out to their families. For those who have completed the IDPH required 14-day quarantine period, we are at 1,053. And for state totals, we are at 1,122,327 that have been tested, with 6,185 positive test results, which is an increase of 766 from yesterday. And for deaths for the state, we are at 6,185, which is an increase of 91 from yesterday. Current hospitalization numbers, and these are for hospitals that are in St. Clair County. Currently, we have 51 people that are admitted due to COVID-related reasons, and 3 of those individuals are on ventilators. For the first facility that we will be reporting for congregate living facilities that are in outbreak status, and that is 2 or more staff or residents that are either COVID positive or who have COVID-like symptoms. Yesterday, we reported atrium of Belleville with 3 cases and no deaths. And today, after finding out that we received some incorrect information, it is now 2 cases and no deaths. Brea of Belleville has 47 cases and 5 deaths. Brea of Cahokia has 21 cases and 1 death today. Caritas Family Solutions of Belleville has 12 cases and no deaths. Caseyville Nursing and Rehab has 3 cases and no deaths. Cedarhurst of Shiloh has 12 cases and no deaths. Cedar Ridge of Lebanon has 49 cases and 2 deaths. Colonnade Senior Living in O'Fallon has 5 cases and no deaths. Four Fountains in Belleville currently has 104 cases and 26 deaths. Help at Home in Belleville has 2 cases and no deaths. Help at Home in O'Fallon has 5 cases and no deaths. Knollwood Retirement Center in Caseyville has 8 cases and 1 death. Lebanon Care Center in Lebanon has 54 cases and 10 deaths. Memorial Care Center in Belleville has 44 cases and 5 deaths. New Athens Home for the Aged has 53 cases and 5 deaths. St. Paul's Home in Belleville currently has 42 cases and 14 deaths. Swansea Rehab and Care Center has 28 cases and 4 deaths. And TDL Incorporated in Belleville has 4 cases and no deaths. So as you can see today, we did have some pretty drastic spikes in our long-term cares. But as we have said, the more we test, we do expect to see that number rise, but today it was a pretty steep increase.
And that's the reason for the testing. And the state total number is actually 130,603. There was a typo on the sheet here that had both at 6,185.
Okay.
So anyway, that's the state total. All right.
And now I will turn it over to Chairman Karen for his update.
I look forward to it. Thanks, Sam. So we'll move into the zip code reports today. Remember, if you don't hear your zip code, it isn't because you don't have a COVID positive person in your zip code area. It's because you haven't risen to the level above 5 yet in your particular zip code. So in 62059, we remain the same today at 7. 62201, we remain the same at 27. And 62203, we remain static at 48. In 62204, we increased 1 to 56. In 62205, we increased 1 to 64. And in 62206, we remain the same today at 126. In 62207, we go up 2 to 88 today. In 62208, we remain the same at 85. In 62220, we go up by 2 today to 153. 62221 goes up by 1 to 132. 62223 goes up by 1 to 59. 62226 goes up by 3 to 168. 62232 remains the same at 28. 62239 remains the same at 15. 62243 remains the same at 8. 62254 remains the same at 57. 62257 remains the same at 11. 62258 goes up by 1 today to 17. 62260 remains the same at 12. 62264 goes up by 1 to 49. 62269 remains the same at 86. And 62285 goes up by 1 to 18. So we're hearing in the news, that a number of states that opened up too early are now seeing a rise in their numbers. The reason why we stick to the doctor plan, to the medical plan, the scientific plan that says move into stage 4 in 2 weeks on the 26th if you meet the metrics, is because we want to make sure that once we go forward, we don't have to go back again. And now there are a lot of states that are reconsidering opening up too early. A couple of those states are having issues again with the number of ventilators in their hospitals, and we don't want to go back in time. We remember that back in March and the fears we had in March and April. We want to continue to move forward. So let's stick to this plan now. June 26th is not that far away. If we continue to wear the masks and do the social distancing, continue to wash our hands, of course, which we're going to do forever, not just after this is over, we'll be able to get through this and not have to worry that we're going to be moving backwards. Is that right, Herb?
Well, as I said, the roller coaster, I'm getting stomach pains over that. Every day, just when Sam comes in and we think we're okay, and we understand we're going to see those ups when we do the more testing. Our long-term healthcare facilities where all of our vulnerable loved ones are, those places are doing a tremendous job trying to do the best they can. I want to thank you, Chairman. We ended up getting a Gatorade out there to Lebanon this morning, and they were really appreciative to that. So again, if anybody feels like donating, they can do so at the St. Joseph Church in Lebanon, and they're asking for Gatorade to be dropped off there that's being used in the nursing homes out there. So we took a truckload out there today. Chairman Karen sent us out there with that. We had 11 agencies pick up PPE equipment today. And the other thing, Chairman, we kind of just today, we talk about regions 4 and 5, because that's what our metrics are based on. And I just thought it would be informational to give out to our followers. And it's 42 hospitals make up that region 4 and 5 that we're keeping an eye on every day to make sure that those numbers stay below where we need to be. And so I know there was a couple of questions that some people had about, was it just the hospitals in St. Clair County? We're really concerned about them, but we're concerned about regions 4 and 5.
Because our percentages are higher than the rest of the region. I think Sam would verify that. We still are higher than the state average. That's why we're continuing to talk about
If we
this.
wouldn't have been added in to the way the task force did it, and if we were just based on ours, June 26th would have been way down the road, I believe, for phase 4. So it was a good thing. I know some people said, why weren't we by ourselves? Well, that's one of the reasons why. And, we want to share in that wealth of those numbers.
And you have to look at this regionally.
Yes.
I mean, it has to be a bigger picture scenario.
Right. So, that's the report for the day. 3 more deaths, we're at 117 here in the county. One is too many, but 117 is, we want that to stop, and we want those numbers to get us to the June 26th phase 4 just a couple of weeks away, as the chairman said. Let's continue to wear the mask, practice the social distancing. We've came this far. 2 more weeks. I mean, we don't want to see here we get a couple days within that June 26th, and all of a sudden the hospitals get overran again, and we just don't need that. So continue to do what you're doing for Team St. Clair and be a part of that, be a part of the solution and not be a part of the problem. And we'll get through this. Cindy and Daisy will be back here momentarily. We want to give a shout out to Randy. He got a little bellyache today, and so Brian's doing double duty. So Randy, get back here. And if something's messed up on this, we're going to blame Brian today. So, but Cindy and Daisy will be back here to translate this into our Spanish communities. Have a good rest of the evening. We'll see you back here tomorrow afternoon at 3:30.